Your Excellency, Esan Northeast, Esan West is happy to have you in the midst. Esan Land is happy to have you. Thank you, sir. You're welcome. The way can see Governor. Obaseki. You're welcome, sir. Yes, sir. While we remain standing, we're going to have the national anthem. At the count of 3. 1, 2, okay. 1, 2, 3, the national anthem. Arise, O. Thank you very much. Ladies and gentlemen, please join me to welcome the Executive Governor of Edo State, the way you can see Governor, the Governor of the voiceless, the Governor of the people, Governor Godwin Obaseki. Can we give him a big round of applause? And he is not here alone. They say behind every successful man, there is a woman, a very strong woman. And ladies and gentlemen, join me to welcome his amiable wife, Mrs. Betsy Obaseki. You're welcome. Before we give a rundown of names of dignitaries that are here to grace this occasion, I would like to quickly inform us that we are here. This occasion is about the launch of the telemedicine service at Central Clinic, Upenu. Now, ladies and gentlemen, Your Excellency, ladies and gentlemen, I chose to look up the meaning of telemedicine and in the dictionary, and it says it is the use of electronic information and communications technology to provide the support of health care when distance separates the participants. What that means in a nutshell is that it is remote medicine. When you cannot be physically present to see a doctor, you can reach the doctor remotely. But I'll leave that for the expert to throw more light on. Today, my co-MC is no other person than Miss Odion Ozamiri. Your Excellency, the Honorable Commissioner for Health, Dr. Samuel Ali. You're welcome, sir. Then we have the Executive Secretary, the Edo State Primary Healthcare Development Agency, Dr. Omosigo Izedome. You're welcome. Your Excellency, the local government chairman of Edo Central are also here. I would like to introduce the chief host of today's occasion. The chief host of today's occasion is the executive chairman of ASA government, the person, the Honorable Collins Aigbogun. You're welcome. We also have Honorable Dr. Kelly Nedegbo, ably represented by his Vice Chairman, Honorable Thomas Otoiwili. You're welcome. Your Excellency, we also have the Executive Chairman of Igweb and Local Government, Honorable Engineer Clement Aswilime. Please, can we give him a big round of applause? We also have the Executive Chairman of Eastern Southeast Local Government, Honorable Louis Imadu Belu, ably represented by his Vice Chairman, Mrs. Susan Otekwe. You're welcome. Your Excellency, heads of local government administration here present.
I think with Governor.
Okay, Edo Central. The Executive Chairman of Edo Central is also here. He's no other person than Honorable Paul Iyoha. Please, can we give him a big round of applause? Then we have the heads of local government administration in our midst. In no particular order, Your Excellency, we have Mrs. Osawe Domana Ohiku, the head of local government administration, Edo Central. You're welcome, madam. We have Dr. Greg Ehimihele, the head of local government administration, Igwebe. We also have Sanitarian Ayo Uduigwome Michael, the head of local government administration, Eastern Northeast local government, Uromi. We also have Charles Superi, head of local government administration, Eastern West local government. We have Mr. Semige Bemudia, the head of local government administration, Eastern Southeast local government. At this juncture, I'd like to hand the microphone to my co-MC for other formal introduction. Thank you.
Your Excellency, sir, I would like to introduce the presence of the telemedicine consultant, Dr. Philip Osehobo, and he's here with his beautiful wife. Please, a round of applause for him, please. I would also like to introduce the presence of Dr. Joseph Abulime, who is also here with his beautiful wife. He is the chairman, ASANC. Also representing the Onoje of Ekboma, we have Chief Odion Osemelu. Please, a round of applause for him. I would like to also recognize the presence of Bishop Dr. GJ Iyemubu. A round of applause for him. And we have the secretary to Ujogba Palace and representing the Onoji of Ujogba, Chief Ebodage Rufus. A round of applause for him, please. We also have the Eastern West Market Women Association, led by the president, Madam Clara Odionhere. And then the vice president, Eastern West Market Women Association, Mrs. Dora Osazuwu. A round of applause for her, please. And we have the coordinator of the Eastern West Market Women Association, Mrs. Regina Ahereme. A round of applause for her, please. And we also have the secretary to the Eastern West Market Women Association, Mrs. Mebe Ohiyon. Also, we have the former PDP chairman, Eastern West Local Government, Barrister Ijakwa, sorry.
Your Excellency, me to welcome the Executive Secretary of the Edo State Primary Healthcare Development Agency for his welcome address. Thank you.
Good afternoon, ladies and gentlemen. Permit me to stand on the existing protocol. Nations who know how to create wealth pursue basically health and education. And so that's where we are in Edo State. We're pursuing health and education at the very foundational level with a single-mindedness.
Obaseki hand.
And we started with creating access to these very vital um, infrastructure. And today, what you're witnessing is what you'll be witnessing is also creating that asset through virtual means. And so, like the umpire mentioned, um, we're creating the asset through telemedicine. And what is telemedicine? Remote access so that people can, wherever you are, can reach that basic need of healthcare through technology. And as you know, primary healthcare is appropriate technology. And for us in Edo State, virtual medicine is now appropriate for us. So gone are the days where primary healthcare is seen as healthcare for the poor. What primary healthcare actually means now is, for us in Edo State, it is care for everyone and meeting our functional needs. I'm delighted that in this collaboration, we've partnered with Asian People's Congress to develop this partnership. And the consultant here, Dr. Philip Oserebo, we thank you for this. Through this very dint of hard work, you can now see patients like you're seeing them in America, and we'll showcase that. Dr. Philip Oserebo resides in America and has been doing this for us for almost 2 years now, 3 years now. And people who come here feel there's no difference when you sit in his consulting room in America and in this Esan West as it stands now. So thank you very much. The Asian People's Congress America is one great group that has shown us what it is to give back to society. And today we'll be showcasing that give back. Mr. Dr. Joseph Abulime stands to represent them. So on behalf of the members and staff of the Edo State Primary Healthcare Development Agency, I want to say thank you for coming and welcome to this very momentous moment. Thank you.
I think we can do better than that, please. And that was the welcome address of the Executive Secretary of the Edo State Primary Healthcare Development Agency. Thank you, sir. Your Excellency, the information I gathered is that this telemedicine is first of its kind in Edo. I gathered that somewhere in Benin, and so this is first of its kind in Edo Central and perhaps Edo North. So without further ado, Your Excellency, I would like to invite one of the champions of the telemedicine, talking of the consultant and president of the Association of Nigerian Physicians in the Americas, Dr. Philip, to come for his office, please. Thank you. And I want to quickly, before he gets to me, I want to quickly recognize a former executive chairman of this local government, Honorable Monday Abulu. Thank you.
Your Excellency, sir, as the very energetic, vision casting executive governor of our wonderful Edo State, Governor Godwin Obaseki, I salute you, sir. And our champion of champions for telemedicine, the amiable First Lady of Edo State, First Lady Betty Obaseki, I salute you, ma'am. I like to stand on the existing protocols. Want to say hello to my friend Dr. Samuel Ali, the team that have worked with us. I'm Oga Pata Pata. It's our People's Congress, Dr. Joseph Abulime. This is a dream come true. Thank you so much for all your hard work over the past few months. And your wife, thank you so much. We're here today. And I know that our people back in the States are excited about this wonderful day. Ladies and gentlemen, allow me a few minutes to talk about telemedicine, how we got here. I am not the president of AMPA, just for the record, but we started here in 2022 when AMPA came and had the first, biggest, largest medical missions with the support of His Excellency, Her Excellency, in 2022. That was the largest medical missions ever taken by physicians in diaspora. And following that medical missions, Her Excellency championed what we are going to describe today, which is a means of continuing to see people after we have come, and a means of continuing to take care of people even when we are not here. That is telemedicine. Telemedicine is the exchange of medical information through telecommunications. As Dr. Omo alluded to, it is a doctor sitting in a distant site and giving professional consultative service to a patient sitting in another distant site. And for us, what we started in Edo South is myself and some of my colleagues sitting in our offices in the United States of America and started seeing patients through virtual medicine in Oredo PHC, Ubo PHC, and now we are in Central PHC. All of these have been made possible because of the collaboration with AMPA, with EPC, and again, I cannot but describe our champion of champions, the First Lady, for her support for the past 2 years. Thank you again, ma'am. Why telemedicine? Why do we need to do something different? Because what you're going to see and hear about today is a radical change from how we normally do and take care of patients. It is not a different kind, but it's a complement to what we are having and what we're doing. Just for the next few minutes, I'll give you 3 points on why telemedicine. As we know today, there is a need for doctors to be able to see patients, and the standard that was set by the World Health Organization is that one doctor should be able to be assigned to 600 patients. In Nigeria today, it is one doctor to 10,000 patients. There is no way, humanly speaking, we will meet that goal of 1 to 600 patients in present-day circumstances. Even if we open 100 medical schools today and give 100 student scholarships today, it is going to take 50 years to come to that goal of one doctor to 500 patients. Therefore, we have to start thinking differently if we are to meet those goals. Number 2, in the United States, Dr. Abulime, we agree with this. One of the diseases that kill people is called hypertension and diabetes. They contribute to heart disease and stroke. But it will be interesting for you to note that in the United States, people live up to 80 and 85 years old in spite of these diseases. In Nigeria, the life expectancy is 50 to 55 years, even with these diseases. So we have to ask ourselves the question, why is it that the diseases that are not killing people in America are killing people here? And the answer is simple. There is no access to good quality care, and there is no management of these chronic diseases. So telemedicine is an answer to that particular problem. That's the second reason why telemedicine is useful. Number 3 reason, there are over 30,000 primary healthcare clinics right now established in the country. Only 20% of those clinics are functional, meaning we do not have enough doctors manning those clinics. I submit to you, ladies and gentlemen, that in the I mentioned already about the discrepancy between the number of doctors and the patients. Those 30,000 PHCs will not have enough doctors 50 years from now. Therefore, something to mitigate that problem is telemedicine. So when AMPA came in 2022, the idea of changing the way PHC operates became a conversation. And Her Excellency, on Channels TV in 2022 declared that there was something AMPA was bringing to solve the problems I just mentioned. It was called telemedicine, and she was hoping that this new way of delivering care was not just something we did for that 1 week in 2022, it was something that would be continued. And yes, indeed, we have continued that. It has been sustained. It has shown to be viable. And that is why we are now in Edo Central PHC to continue the scaling up of telemedicine. Basically, it involves the fact that you have the interplay of a lot of factors. You have the provision of what we call internet connectivity. And His Excellency has already started that project of laying fiber optics all over the state that will continue to help with that process. We should give a round of applause for that, because we are not going to be moving from MTN to Glo to routers anymore. We are using technology to bring healthcare. It involves constant power supply to man and to carry out these visits during patients' encounters. It involves infrastructure like computers that are going to be needed to continue to see these patients remotely. It means no matter how far people live, we are going to be able to give them access to good, high quality, efficient medical care with telemedicine. So, we have a lot of PHCs that have been informed, that are being revitalized in a very massive undertaking by His Excellency and the team. These PHCs are going to continue to become satellites that ultimately feed into the central hub of telemedicine, like what we have here in Central PHC. Meaning, no matter how many of the outskirts PHCs we have, there is going to be what we have described as a hub and spoke mechanism, where patients at the periphery, we have access to a doctor because of this telemedicine thing. Let me say two things and I will conclude. Number one, Edo State is the only state in the Federal Republic of Nigeria that has telemedicine in the primary healthcare. I can put that further. Edo State is the only state I'm aware of in sub-Saharan Africa that is practicing telemedicine in primary healthcare. Ladies and gentlemen, it is the data we have compiled from these visits and this encounter in the last 2 years that has led to yours truly and yours humbly receiving an award from the American College of Physicians for Volunteerism of the Year and Community Service of the Year from America. The data from telemedicine in our PHC is published in America. And in 2 weeks, I will be in Boston, where this recognition will be made nationwide. What I'm talking about, ladies and gentlemen, is a paradigm shift. Dr. Izadome rightly said it. PHCs are not just for poor people anymore for immunization. We are changing what PHCs are for. We are suggesting a means to help with the physician shortage and decrease brain drain. We are creating and suggesting, like I mentioned to His Excellency on our way here, we are creating an ecosystem of primary healthcare that is powered by a digital operating model. Thank you, ladies and gentlemen, for this opportunity.
Thank you very much. Can we give him a bigger round of applause, please? That was the introduction of telemedicine by Dr. Philip, the president of the Association of Nigerian Physicians in the Americas. Like you heard him say,
that Edo State is the only state using telemedicine in her PHCs. No wonder Edo is the heartbeat of Nigeria. And that also underscores what His Excellency is doing in this state. Can we give His Excellency a big round of applause? And from what I gathered from the introductory aspect of telemedicine by Dr. Philip, it's going to cut down on mortality rate because the life expectancy in Nigeria is very, very small. And with this telemedicine, perhaps we're going to have a higher life expectancy. I believe that's what we are trying to say. And most especially at this point in time when we are beginning to have the adverse effect of the Japa syndrome, I believe this telemedicine will be of immense help to Nigerians, and those state indigents in particular. Thank you very much. Without further ado, I would like to invite the second champion of this telemedicine service is no other person than the chairman, ASAM People's Congress in the US, Dr. Joseph Awolime. And he's also accompanied by his beautiful wife. I guess that is your wife as well.
Anyway, thank you very much. Your Excellency, my name is Dr. Joseph Awolime. I'm the president of ASAM People's Congress in the United States. The Congress is made up of your ASAM sons and daughters in America. This association was started in 2019, and with a primary focus to apply our resources to see what we can do to help our ASAM people. And when we had our convention in Chicago in 2023, in May of 2023, and Dr. Osobo was one of the guest speakers, and he brought up the idea to the association for us to support what he has already been doing in Oriedo and to extend that program to ASAM land. Man, after his presentation, it didn't take us less than 2 hours for the executive to jump on this idea. So I am very pleased that within a few months, we actually have this program going. And that, speaks to the cooperative disposition of our Excellency, Governor Obaseki, and his workers and staff, Dr. Omo and Dr. Ali. When we approached them to be able to use this particular PHC to establish this telemedicine, it did take them a very long time for them to plan. And this is the first of its kind in ASAM land. We are hoping with your support and with your prayer for us to export. It took a little cooperation for us to realize this particular undertaking, and I think we are very pleased with the outcome.
Your Excellency, sir, permit me to welcome to the microphone the Honorable Commissioner for Health, Dr. Samuel Ali, as he takes his.
Those current and past, our royal fathers and others that are here. It's my pleasure to stand in your midst this afternoon. That this place is open. Plus, will not do this. They will just send a representative, but he is here live to see them at the federal level too. 3 weeks ago, the federal government sent some representatives to the Nigerian Governors Forum. Thanks that all this foundation that he has made and all the plans he has will have someone that will continue so that we can continue. It will be very expensive. But through this telemedicine cannot last for long. But what is what we should be looking at, sustainability. And that is why we such as this and many more that will come later. So please, health insurance is the way to go. And when you pay, thank you very much, Dr. Philip and Dr. for all their effort to make sure that we must also have this telemedicine running. So I want to assure you that this is not be the only one, like the other speaker. The cable that is running, it has been stolen. So please, that's why I said, it's yours, it's your own. Live for generations to come. Thank you.
We can do better than that, please. To invite the colossus of Edo State politics, the big masquerade in the house. Excellency of Godwin of Obaseki. Sir.
I don't want the mic.
Ladies and gentlemen, as soon as the governor is done with his speech,
the chairman, Esan West Local Government, who is hosting us, Honorable Colin, State Primary Healthcare Development Agency, Dr. Zodok. He is part of this event today. And he also heard health is today. Our teachers are always in school. We say, no, let us change it. Let us now emphasize primary health care. Receive treatment. But as Dr. pointed, they will now say, okay, but it is not only nurse you meet in hospital or primary health. There are other things. So that we can train the people who will be working in all our primary, at least 200 primary healthcare centers. Let us put solar so that the one that they used to use candle to deliver babies, we don't not let it happen again in Edo State. So in about 50 PHCs today, we have internet, but unlike healthcare is very expensive. That's why many people in the past, they won't want to come to hospital. Whereas if they have come early, we'll find what the problem is before it gets very bad. And because of this, we say we must address this problem of how to pay for health. Government will still continue to put money, but at least we are appealing to those citizens. You also take your own insurance, your health insurance. The one we are doing here now is 50 naira a day only. 50 naira a day comes about 17,800 a year. Anytime, day or night, you just walk out, come into this place, the clinic. Nurse, I don't know how my body they do it. Oh yeah, check. You don't go pay because you don't already pay. Anything wearing your child, you bring. Oh yeah, let me check. So that way we can build a healthier society. And no matter how complicated the problem now is, we have people in America, our children, trained to go and see them there. What it will cost you, you can't even afford it. These people will now sit in their office in America and they will be examining you from there. Okay, nurse, check this one, check this one. Will they look? And they'll say, okay, give them this treatment, give them this medicine. From America. Now people have problems. What problem now? They come, hey, no, I want to go to India. I want to go to this for treatment. Before we get to that, we would have started the treatment here. Because of this telemedicine that we're introducing. The last thing that is making this telemedicine work, as I've told you, each PHC now has its own computers. We now keep electronic medical records. So when us come, now that one that they used handwrite before. your name, your national identity, everything will be in the system. So if you come last week, you complain about something, you come again this week, the record will be. So the doctor anywhere already can see the record, can see what is going on, and then use that to advise on what to do. And the last thing, now we are buying medicines bulk purchase. So that you can't come here and they say medicine out of stock. No. And the medicine will be original, not the one they go and buy from you know where. So I'm here today to join you to bring telemedicine to Edo Central. This one we are doing in Ukraine is just the best in Edo Central. As we are connecting, the PHCs will be opening more. But I'm appealing to you, please, if you have not enrolled for health insurance, go and enroll for health insurance. They say health is 70,000 we waiting to make person no take care of itself. Make a con they say, had I known? No. So I want to thank you. I want to congratulate the chairman of this local government, and I'm sure all the other chairmen are jealous. But don't worry, one of you is a doctor. I'm surprised. I'm hoping that in the next month or two, the one in Urumi should be ready. Dr. Kelly, this is a challenge to you. You'll be doctor, so go and do your own. And all of you, please make sure that you support the healthcare, the primary healthcare agency to help us build out our healthcare system in Edo State through the provision of neighborhood clinics. We're trying not to call it PHC again, primary health, because the notion is that it's poor people that go to primary care. No. So we will call them clinics. This is now going to clinic. And by the grace of God, with this telemedicine, you will get the best quality care from the best doctors in the world here. Once again, congratulations and thank you.
Thank you, Mr. Governor, for that wonderful address. And without further ado, I would like all the dignitaries and the telemedicine champions to move straight to the